Hey everyone. I'm sorry I'm a little late to the live feed. I was trying to figure out how to get everything going. I hope this is working correctly. I just thank you for everybody for joining and watching live as we do this talk on potty training. Um, as you've seen my post earlier, I was trying to take advantage of the time that we had at home with our almost 2 year old, to do some potty training with him, and I just wanted to make sure that everybody else had the same information. I think one of the biggest things that we always tell parents when we're training parents on how to do potty training for their children is consistency, and having a time frame about 2 to 3 days or something like that, to really work consistently on potty training. That's really beneficial. And since we all have some of that time now with our kids being at home and not in school or at a daycare center, that this would be a good opportunity for us to do that. So one of the things that I want to first talk about is that I'm just going to do some general outline of what we're going, of what would work, and some general tips on what would work for you guys. And if you have any type of specific questions, if you are a parent or a caregiver of a child who has disabilities and you've been working on potty training with this child for a while, I would definitely reach out to your provider to get additional information. This information that I'm going to present is general information on how you can address some of these potty concerns, or even get started with potty training with your child, whether they're a neurotypical child or whether they're a neurodiverse child. So one of the first things that you want to know is to identify is your child ready, right? Like, is your child ready? Whether you're doing a first attempt at this, whether you've had unsuccessful training, or whether you've had regression in skills, so that your child has been trained before and then they've regressed on toileting and are having more toileting accidents. So any of these components you also need to know where you are. If it's your first attempt, it's typically a lot easier to get through the potty training process when it's your first attempt. If you've had unsuccessful training in the past, it takes a little bit more work. And if you've had regression in the skills, that also takes a little bit more work, and it could tend to be a little bit more challenging than when you're attempting to do your first attempt. So the first things that you want to know is your child ready, right? So what are the things that you look for when your child is ready? The things that I look for is if the child is making any type of signs or displaying any type of signs that are appropriate for potty training, like going and hiding when they are about to have a bowel movement, or saying things like "I TT'd" or "I'm wet," or anything like that. That would also be an opportunity for you to say, okay, they're recognizing that they are wet. They're recognizing that they are that they need a diaper change. And in that event, when they start talking about pottying, and when they start talking about accidents that they've had, that is, I feel like, a good indicator of whether your child is ready for potty training or not. So know that. That's one of the big key things that you want to assess for readiness. One of the big things is, especially for somebody who's had a lengthy period of unsuccessful potty training, is that you want to make sure that you rule out any type of medical issues. Medical issues are, so you would have to go to a GI or a urologist to try to figure out what is going on with your child and why is the pottying not successful. Because if we don't rule out medical issues and we're treating this simply as a behavioral issue, you can have some challenges that come up with that, and you may have further regression of skills or further resistance to potty training. So definitely go ahead and make sure that you are ruling out those medical concerns before you move forward. So other factors that would determine readiness is the age, right? Like if your child is around 2 to 2 years or above, they're probably ready to start potty training. One of the other factors that you want to also look at for determining readiness is bladder control. Are they staying drier for longer periods of time? Sometimes for my child, there have been nights that he never had accidents, and his diaper was completely dry in the morning when we changed him. And so that is an indicator that they're able to hold and are able to stay drier longer in order to, and therefore may be ready for potty training. Other things that determine readiness is the other interfering behaviors, right? Like, so you want to make sure that your child is able to follow instructions. If they have difficulty following instructions, potty training at that point is probably not the best thing to put your efforts in. You may want to work on getting some compliance and them learning to follow instructions appropriately and the first time you give them. If that's not there, then your pottying, if you think about it, potty training includes a lot of instructions. It includes a lot of following through. And so if you're not able to if you don't have a child who is able to follow directions the first time that you give them, then you may not be ready for potty training. You may want to put your efforts into doing more of that compliance training. So other things that you also want to make sure is that is your child able to understand simple instructions? Go get the ball. Get your shoes. Where is your favorite toy? All of these things are simple instructions that your child should be able to follow. Look at me. Any of these things. If they're having trouble following those simple instructions, again, you may want to put your efforts into building those skills before you start working on potty training. You also want to we talked about indicating wetness or dryness. So if your child is able to tell you, I'm wet or I'm dirty, then they may be ready for potty training. Physical signs of discomfort are also, if your child is not a verbal child, if they're showing physical signs of discomfort, so whether if they're wiggling around a little bit more when they're wet or dirty, or touching their diaper, or or walking funny when they're wet, those are all physical signs that show that, okay, they're not necessarily liking being in this diaper or this pull-up that's wet. And again, that might be a good indicator for you. Okay, maybe we're ready to do this potty training. The other thing that you also want to look at is your child able to sit in a tent for at least 5 minutes. One of the components of potty training is that they have to sit, right? Like they have to sit in order to be able to eliminate. And so if they're not able to sit in a tent for about a period of 5 minutes, then you may have challenges that occur during potty training. So assess for that. And if they don't have that skill, work on that skill first before you start working on potty training. And the other thing, this is a little bit of a less priority one to determine readiness, but if you say pull your pants down or pull your pants up with assistance, is your child able to do that? Again, they don't have to do it independently. It's just that they have to do it with some assistance. If they're going to help you, that might be an indicator that they're ready to. And then obviously showing interest, right? Like I have a 5-year-old and I have, almost 2-year-old. So if my 5-year-old goes to the bathroom and my 2-year-old follows and he'll say something like, brother TT'd or something like that, then we know that they are interested in this, showing interest in pottying. So The other big thing is, now that we've assessed whether the child is ready, you want to make sure that you assess if you are ready. The parent or the caregiver has to be ready in order for this process to start, right? Because it involves a lot of work. It involves a lot of training on your part, and it involves you being consistent with the procedures that you put in place. And so if you are not ready, don't start. Because you would rather hold that off until you are ready and you're feeling like you have the time to put in, you have the patience to put in your, that time. All of those are pretty critical things that you want to make sure that you are ready to start this potty training process. So once you've determined your child is ready, you are ready, then we're ready to go into some of your, starting steps, right? Like, first things that we do, okay, so as a behavior analyst, we are very much into our data. We love our data, and we want to make sure that we collect data. And again, this may be something that you do not necessarily on a pen and, with a pencil and paper. If you can, great. If not, no big deal. What you want to do is to figure out how often is your child voiding, right? Like, how often is he or she eliminating? And so once you've determined that, you'll be able to establish a schedule that works well for your child. So what are some precursor signs? The other thing that you want to look, or your starting point after collecting data, is you want to make sure that you recognize some of those precursor signs, right? Like, so our kiddo the other day, right before his bath, he was straining, and so my husband, he said, okay, it looks like he may have to have a bowel movement, so he immediately put him in the potty, and that worked. My child had a bowel movement on the potty because we recognized that sign. Now, signs for bowel movements are obviously a little bit more easier to recognize than signs for bladder elimination if they have to urinate, and so you just have to kind of go with what you're able to find. And some kids may not display any precursor signs, so if there's no precursor signs that you can find, that's okay too. The other thing that you also want to do is start building interest in the bathroom, right? So take note of how your child reacts when they're in the bathroom. Is it an aversive place for them? Are they okay with it? You may have to start off with the point of just giving them a preferred item when they're in the bathroom, or a preferred edible, and we'll talk a little bit more about that. So if you find that you are not if your child is averse to the bathroom, that's where you need to start. You cannot go straight into potty training if your child doesn't even want to step into the bathroom. So you want to start where your child is. Meet your child where your child is, right? So then you want to work on some preparation. So potty chair or a seat, what are you going to use? Are you going to use a separate potty chair that they sit on? Or are you going to put a potty seat on top of your regular toilet? Then you're going to want to determine what kind of drinks and water, and I'll talk a little bit more about that in a minute. Then you're going to want to determine and prepare and make sure that you have plenty of fluids for your child to consume. And then you want to see if you have a timer or a clock. I use my Apple Watch all the time to set my timer, so as soon as we get out of the potty, I make sure that we set the next timer. And so the other thing that you want to look at is an underwear versus a pull-up. I get that question a lot. Do I use a pull-up or do I use underwear? My preference is underwear, just because they feel the wetness a little bit more. Pull-ups and diapers these days are so great. They're super absorbent, and the child typically doesn't feel the wetness, and you want them to recognize when they're wet and recognize when when urination is happening. So it's a little bit easier for them to get a cue of what's going on if you have if they're in underwear. You can do either underwear or no underwear at all, and go, be in your, in your birthday suit. You can do pull-ups if you want to. Again, like I said, my preference would be just underwear. If you do pull-ups, I do suggest that you put underwear and then put the pull-up over it so that they can still feel the wetness, but you're not having as many accidents and you don't have to do as much cleanup when that happens. The other thing is that you want to look for is rewards. How many what kind of rewards are you going to give your child when you are starting potty training? One caveat about the rewards is that you want to make sure that your child does not have access to this reward at any other time other than when you're doing potty training. So for our child, we use M&Ms. That's one of his favorite candies, and he only has access to chocolate and M&Ms if he engages in appropriate potty behavior. And I put them in a little jar, and I put them on a shelf in our bathroom so that they're visible to him, and so that he is able to recognize, okay, M&Ms are associated with pottying at this point. And then you want to determine your training schedule, right? So with your data that you've collected, or mental data that you've collected, you know that your child eliminates every 20 minutes or so. If that's the case, then you want to set your schedule where you're doing your potty sits every 15 minutes. If your child is eliminating every 30 minutes or so, or 35 minutes, you want to make sure that you set your schedule or your potty sits for every 30 minutes or 20 minutes if you want to beat that clock. So the general process includes your antecedent strategies, meaning what do you do before the pottying accidents happen. So some of the things that you want to do is to increase fluid intake, right? And so the reason being that we want our child to have as many opportunities as possible in order to either be successful or not successful with pottying. Preferably successful, obviously, but we want increasing the fluid intake will help get that going a little bit. And then you want to do your scheduled sits. So again, when you determine every 15 minutes, are you going to do your scheduled sits, or are you going to do every 30 minutes, whatever it may be, you want to make sure that you have a good consistent system with that. And then the other thing, it's not as important, but it could be helpful, is doing a scheduled check. So if you're doing a scheduled sit every 30 minutes, you may want to do a scheduled check every 15 minutes just to reinforce the dryness. And it also helps you determine, do I need to move that schedule up a little bit? So how long do you have the child sit on the toilet? I say no more than 5 minutes. You don't want to make that toilet time aversive. The longer you sit, they're going to get bored. They're not going to want to sit, and you're going to have a harder time getting them back into the potty. So don't do any more than 5 minutes. For my child, I've even he'll say, I'm all done after about 2 minutes or so, and in that event I'll say, okay, you're all done, and then I pull his pants, help him pull his underwear up, and then we move forward. So gauge that, but no more than 5 minutes for your child to sit on the potty. What do you do while they're sitting there? Make it fun. We sing songs, we read books, we do tickles, anything that can make it fun to sit there, you want to do. You don't want to sit there just looking at your phone or looking at the child. You want it to be engaging for the child while you're in there, so that they are more likely to go back into the potty, into the bathroom without having challenging behaviors. So you can modify sit times based on the data. Again, if you see that your child is going 40 minutes without having a potty accident and your schedule was 15 minutes, move your schedule to 40 minutes. Be flexible with that. But use your data to inform your decisions when it comes to that. So with rewards, what behaviors do you want to reward first? There's several behaviors that you can reward. You can reward remaining dry. You can reward if they actually void in the toilet. So for us, for example, we are rewarding only for successful eliminations in the toilet. And then you can request, or you can also, if you're working on them requesting to use the restroom, you can reward the requesting also. Now, if you have a child who has an aversion to the bathroom and doesn't want to go in, you may need to reward closer approximations of them moving to the bathroom. So as soon as they step in the bathroom, you may want to engage in the reward, or give them the access to the reward so that they start associating the bathroom with something a little bit more positive. When do you reward? Immediately after the behavior. You always want them, especially because this is a skill that we're teaching them and it's very new to the child. You want to immediately deliver the reinforcer, and you want to initially reward them every time that this behavior occurs. You want to make that known. So children, when you're establishing, okay, this behavior leads to this reward, they need that consistency to make that connection. And so if you're intermittently or only rewarding sometimes and not other times, and you're being inconsistent with that reward, that child is not going to make that connection. And so you want to make that connection. And how do you reward? You always want to pair your reward with praise. So that eventually you can take that external reward out and it'll just be praise, and then you'll be able to move forward with that. Reward, again, like I said before, you want to make sure that your reward that you choose is only available during potty training. Okay, so those are our big takeaway points. I do want to talk a little bit about what if accidents happen, because they are. I will tell you, we changed our child's underwear about 6 or 7 times. Every time it was wet, and you're gonna expect, and I just want you to expect that and know that that's gonna happen. And so we went through underwear very quickly the first day we did our potty training with him. So make sure that when the accidents happen that you don't reprimand. Use a neutral tone. Oh, you're wet, let's go to the bathroom, we'll change, and then we'll move on. You can also give your child a little bit of a reminder. Remember, if you TT in the potty, you get to have M&Ms. You're going to bring your child to the bathroom and have your child help with cleaning up as much as possible. If you have an older child that's going through this, if they can help you clean up, that's going to be good. Again, don't make it an aversive thing. You want to just use a neutral tone as much as possible when it comes to redirecting accidents. So those are our general tips. I have a potty training guide. If anybody wants to have access to that, I will post it on our Facebook page, and you guys are welcome to use the data sheets that are associated with that, and all of the steps that go with pottying. If you have any questions, feel free to post the questions. Again, we may not be able to get into the specifics of your, if you're having struggles with your child without really seeing your child, but we'll be able to give you some general tips on how to make that a little bit more successful for you. Thank you for watching. If you have any questions, again, please follow up with us. Thanks. Bye-bye.